Dr. Erica joins us in studio, and today we're talking about World Pancreatic Cancer Day, which is November 21st. And I wanted to start off by asking, what is pancreatic cancer?
So pancreatic cancer is a cancer of the pancreas, which is the organ tucked in there with the stomach, with the liver, with the intestine, and it's responsible for producing different enzymes to help digest your food, as well as hormones to help regulate your blood sugar, like insulin. And you can see it on that image right there, where the pancreas is kind of that yellow organ.
Gotcha. And what are some of the risk factors that might add up to developing pancreatic cancer?
You know, they say age is the #1 risk factor. Most pancreatic cancers are diagnosed over the age of 70, but we do know that younger adults are being diagnosed with this. Being overweight and maybe some dietary risk factors like processed meats. Smoking is certainly a big risk factor, as it is in several other cancers. Longstanding diabetes or recurrent pancreatitis, and then a family history of pancreatic cancer is important for patients to be aware of, as well as share with their medical provider.
And let's talk about some of the symptoms, because we were just talking off air about how the people who we've known who have been diagnosed and passed away from this, it hits them all at once and it happens pretty quick.
It's horrible. It's, you know, definitely one of those cancers where once you do develop symptoms, often, not always, but often it already has grown to a point where it's creating those symptoms to where it's already a higher stage of disease. But, you know, some of the main things to watch for are unexplained weight loss, appetite changes where you just don't have much of an appetite, jaundice, which is yellow discoloration to the skin or the whites of the eyes. Stomach pain can definitely develop more in the epigastric, kind of upper abdominal, and if it radiates through to the back, that's an important detail to notice. New onset diabetes and changes in your stool would be another thing to let your doctor know about if you had any of those symptoms.
All right, and let's talk about treatment, and is there any hope? I mean, so many different treatments have come a long way over the years, but what are we looking at now?
So the sooner diagnosis, the better patients are going to do, but there are a lot of treatments, and we have made great strides over the last couple decades to where we are keeping people alive longer, but surgery in some patients, chemotherapy, radiation, and now, as in a lot of other cancers, immunotherapy and targeted therapies with radiation or targeted surgeries can definitely be an option for some patients when they are diagnosed with this tough disease.
Yeah, all right, and one of the deadliest too, I was reading, one of the deadliest
It
cancers.
is. They think about in Montana, or in the United States this year, about 57,000 people will be diagnosed with pancreatic cancer, and about 46,000 will die every year in the United States.
Heartbreaking.
It is.
Well, Dr. Erica, thank you so much for being in the studio and shedding some light on this. We really appreciate it.
Thanks for having me.
We'll be right back after this break.